Hello and welcome to a short instructional video on the use of disclosing tablets. So disclosing tablets are quite a useful tool for engaging a patient with their oral hygiene routine, especially with children because it's a very visual aid. And what disclosing tablets or disclosing solution, which is also available, what that does is it uses a dye to highlight areas of plaque that have not been removed through brushing and intradental cleaning. These that I have just now, these are by the sort of popular brand TP, which you may have heard from with the use of the intradental brushes that are very common or commonly used as a brand. These were quite difficult to get. I actually had to buy these online. I had to get them off of Amazon and have them delivered to me because I couldn't find them in a supermarket, which was quite strange. I expected it to be a bit easier to find, but they are readily available in most dental practices. So if you're recommending them to a patient, it might be handy to check if the practice that you are in does actually have disclosing tablets available to give to patients or to sell to patients, or recommending that they do look to maybe online suppliers and online shops rather than maybe the high street shops, although Boots website does say that they have disclosing tablets available. So these ones actually use two different colour dyes. They use a red and a blue dye. The red dye shows new plaque and the blue dye will highlight sort of older or mature plaque. And they come in little individual packets so that you can just tear off one disclosing tablet and put the rest back into the box. So these should be used ideally at a time where the patient isn't having to really go anywhere. So at night is quite a good thing, rather than sort of first thing in the morning before they're maybe going out to nursery, school, work, etc. Because they do actually stain, and the dyes within them can stay things like clothing, furnishings, sort of like the skin. So you want to make the patient aware of that and try to recommend that they find a time where they can sort of be able to sort of wash away the dye. It might need like a couple of brushes after it to sort of get rid of it. So a couple of things that you sort of want to recommend to the patient to have when they're going to use a disclosing tablet. You want them to have their toothbrush, whether that's a manual or an electric, and the toothpaste that they use, and also whatever interdental aids they use for cleaning in between the teeth. So I have like TP brushes here, but it could be floss as well, or flossettes. When you're using a disclosing tablet, you should brush your teeth as normal and clean interdentally as normal, because we're wanting to see what areas are being missed when brushing and when interdental cleaning. So if that's not done ahead of using the disclosing tablet, then it's sort of going to give us like a false reading, if you like. So we want to brush our teeth and clean interdentally immediately before we start to use a disclosing tablet. Before using the disclosing tablet, you should recommend to the patient they also have a little bit of Vaseline or petroleum jelly, and they just want to take that and just put it around their lips, just to prevent any dye from getting onto the skin or the soft tissues on the outside of the face. That should be enough there. And then what they're going to do is take out their tablet and they should pop it into their mouth, chew it, swish the sort of residue of the tablet all around their mouth, and then spit out. So it's very important that they don't swallow it, and it's very important that they spit out the excess because you don't want to sort of have a lot of excess dye. It's also important that they rinse out immediately after using the disclosing tablet as well, just to get rid of any excess dye. Now, I'm not going to use this just now on the video, because then I'll probably have to talk to you with a stained mouth for the rest of the day. But I will upload a little picture so that you can see how it looks with the red and the blue dye for new and mature plaque. Once they have chewed the disclosing tablet, swished it around the mouth and discarded the excess and rinsed, what they want to do then is look in at their mouth in a mirror so that they can see the areas that they are missing when they're brushing. And again, obviously, if it's blue, then that's areas that are being missed most commonly, because there's plaque being left over time. So that's a good thing to identify. And obviously, if there is red plaque being highlighted, then these are also additional areas that the patient should be able to see that they are missing. Now with children, you can sort of make it a bit of a game after that, because you can encourage them to brush away the dye and try and get rid of as much dye as they can. And then the next time you do it, you're trying to get less areas and less areas till you have none. So you can make it a very fun and engaging aid for child patients specifically. Thanks very much for watching, guys.